Hi everybody, welcome back to Brown Plastic Surgery. Dr. Brown here. I have a topic that I get asked all the time that I want to discuss a little bit about massive weight loss surgery. Everyone asks me, what are all the different kinds of procedures that you can do after massive weight loss? And so there are a lot of things. And first of all, I always like to, at the top of these questions, to say congratulations to you if you're that person and you've taken the initiative to lose all of that weight. I'm grateful that you took that step because it's gonna just carry you through the rest of your life in health and wellness, and I'm all about that. So let's start at the top here. So this is an uncommon one that most people don't think about, but I actually have been asked to do this procedure a few times, and that's a facelift and a neck lift. There are a lot of times when someone's lost so much weight that they end up getting the big old turkey neck and they end up having jowls and they have a very gaunt looking face because they've lost so much fat. In that case, I might put them through a multi-step process where they see my injector to do some filler to reestablish some volume to the face, and then they may need a facelift. Literally a facelift after massive weight loss surgery. It's happened. I've had a few people want that. So we're gonna work our way down the body here. The second most common thing that I get, or I would say the first most common thing I get, is arm lift surgery. So as you all know, that once you lose a lot of the weight, you've got these big flaps of skin on your arms, and a lot of people are very self-conscious about wearing short sleeve shirts because of that. So that requires an incision, usually either down the back of the arm or on the inside of the arm, and we take out all of that extra skin and we make things as tight as we can. Occasionally, I need to combine that with liposuction, so some people still have some extra tissue there that we need to liposuction down the bulk and the volume there, and that gives me the ability to remove more skin. The next procedure we're gonna discuss is gonna be the tummy tuck. Now, with massive weight loss surgery, I want to discuss two types of tummy tucks. The first type of tummy tuck is the traditional tummy tuck, where we make an incision from hip to hip. We elevate all of the skin up to the rib cage. We have to make an incision around the belly button to leave the umbilical stalk behind. We pull all of that tight, and then we make a new opening for the belly button. And that's a traditional tummy tuck. And we also suture the muscles. If you've heard the term diastasis recti, one of the situations where people get diastasis is not just from pregnancy and having kids, but massive weight loss, because when you were heavy, you carried a lot of visceral fat, which is the fat around your organs, which causes bulging and stretching of those six-pack muscles, which we need to reestablish that anatomy. So that's the first type. So the first type we do is a traditional tummy tuck. Now, if you're someone who's bigger and you have even more excess skin, sometimes just simply pulling that skin tight down isn't enough to create that corset tight look that you're looking for, that hourglass shape in your waistline. And then we have to do what's called a Fleur de Lis tummy tuck. If you guys are familiar with what a Fleur de Lis is, it's the three-lobed flower. And so that's what this procedure looks like incision-wise. The drawback is you need an additional incision, the one that goes across the lower belly. We then add a vertical incision all the way up to the breastbone, because what we're needing to do is to tighten in the waistline this way and pull the skin down and tight. The unfortunate part is you have a scar that goes up and down and then along the abdominal crease, and that's the T-junction there. So that's called a Fleur de Lis tummy tuck. The next common procedure that patients might ask for would be a thigh lift. So sometimes patients will have, if you've got your thigh, your vertical thigh here, they have circumferential tightening that they need, but they also need, like if you were putting your hands in your pocket and pulling up on the thigh, want that kind of tightening of the skin too. So that usually requires an incision that goes up the inside of the thigh, and then we call it hockey sticking it into the groin, which allows me to, number one, I can circumferentially tighten up the skin, and then number two, I can also pull the skin upward to try and secure that. Now, gravity always wins. It never stays as tight as you think it's going to take, but that's the next most common procedure that I do, would be a thigh lift. The next procedure I'd like to discuss is a full circumferential body lift, okay? Not everyone wants or needs a body lift, but what a body lift is we essentially do everything I already talked about, like either the Fleur de Lis or the traditional tummy tuck on the front, but we then carry that incision all the way around to the back. So in the beginning of the operation, we might start on the back, where we do a butt lift and a back lift, where we're basically tightening the skin down from the back and up from the butt, because a lot of times the gluteal area becomes very flat with weight loss. And that's called a body lift. So when we start in the back and we lift that, and then we lift around the sides, we can pull the thighs up from the side, and we continue to the front to also do the tummy tuck. That's called a circumferential body lift, and that's a big operation. Now, if someone doesn't want to just do a circumferential body lift, sometimes I just do the gluteal lift on the backside, where we actually do a butt lift and take out the skin to tighten things up. And I call this a lift and fill procedure because we add a Brazilian butt lift procedure. And what that is liposuctioning fat from somewhere in the body and injecting it into the bottom. So that addresses two things we talked about. One, laxity of skin or hanging skin in the gluteal area, which we want to tighten and pull up. And then we need to add volume by adding fat. So that's another procedure that we can commonly do. Another procedure that I'm often asked about is the bra line lift. A lot of patients have so much extra skin along the bra line. They have flaps of skin on the upper back. And we can actually, in conjunction with some breast surgery that we'll talk about, we can carry that incision around to the backside to remove a wedge of skin on the back to take away a lot of that skin. The next thing I want to talk about, which I skipped, was breast surgery. So a couple things happen with breast surgery. Some patients who don't want an implant can just get a breast lift. The problem with that is a lot of times with massive weight loss, you don't have a lot of volume in your breasts, and so you need some kind of volume to give you shape. But in this day and age with breast implant illness and some of the other topics, I have these conversations with my patients, and some are okay and feel safe having them and some don't. So the two procedures you can have done is either a mastopexy with an implant, or some people just get the mastopexy. So those are another set of operations that someone may have. The last thing that I'll talk about, which is a little bit more rare, would be a thoracic lift, where some people have an incision that goes up and down the armpit to actually tighten the back more. That's a less common procedure that I've seen done, but I have seen a few people do that. So that covers the full gamut of what someone might come into me to ask for. Not everyone comes in asking for all of those procedures, but I just wanted to cover from A to Z what most of the procedures are that are associated with massive weight loss surgery. So thanks for joining me today. I hope that gives you a lot of information. Have a great day.